please join me in welcoming Sherrie Logan and Rienk de Vries, who will lead the breakout session on PFD perspectives on COVID-19 and mental health. Sherrie is the founder of Ashley's Angels, a third-party fundraising initiative supporting the transplant program at the Hospital for Sick Kids, which she formed following her daughter's liver transplant in 2009. Sherrie is a patient partner with CDTRP, Society of Pediatric Liver Transplantation, Patients and Family Engaged Partners, and Starzl Network. Recently, Sherrie has become a co-lead of the Exercise Hub Theme 5 with CDTRP and is pursuing a master's in public health at the University of Alberta in the fall. Congrats. Rienk de Vries lives in Oakville and runs a consulting firm that has provided services in the water industry for more than 15 years in Canada, the US, and the Caribbean. Rienk has been a patient researcher and a PFD representative on CDTRP Theme 5 for a little more than a year now. He had a heart transplant in December 2012 and has been involved in a number of transplantation-related research projects over the past 10 years. Over to you, Sherrie and Rienk.
All right, so let me start. So Sherrie and I are going to be doing sort of a dueling banjos thing here, but I'll start the presentation off. I'm just going to share my screen and make sure that everybody can see that. Can everybody see that?
Can you go full screen?
How's that? Better?
Oops.
Okay.
Basically.
Can you see it now or not?
Yes. Well, could you go full screen?
I am full screen on my screen, but okay. So if I go forward, you can't read those?
No, I'll take over and just let me know when you want to switch slide.
Okay, do that, and then I'll. Okay, do I have to unshare my screen? You already did it.
No, I'll do it.
Okay, thanks. All right, can you see that now?
Yes, looks good. Yes.
Okay. All right, so let me get started. So the title of the slide here is Patient, Family, and Donor Perspectives on the Impact of COVID on Mental Health and the Need for Supports to Improve the Transplant Journey. For any of us that have gone through various parts of that journey we've talked about the last couple of days now, COVID didn't help much, and it certainly took a toll on a number of people, both from the caregiver perspective and also from the patient perspective. So underneath this, we are continuing the thread that we've had in terms of, trying to find ways that patients and families and donors can participate in this whole process to help move us forward in making sure we work towards better outcomes. So this picture here is more meant to be kind of the end of the tunnel there, with the light at the end of the tunnel. So we're going to take you through this, but before we do that, I wanted to give a little bit of a land acknowledgement. I work and live in Oakville, Ontario, which lies on the treaty lands and traditional territory of the Mississaugas, the neutral Huron-Wendat and Haudenosaunee First Nations. And Sherrie lives and works in Barrie, Ontario, on the traditional territory of the Anishinaabe people, which includes the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy. We also acknowledge the Wendat Nation that occupied those lands around Barrie prior to the middle of the 17th century. And so with that, can you go to the next slide, please? The objectives of our session today, and we promise not to talk too much because we really are looking for your input in this process. So we want to better understand transplant patients, family, and donor perspectives on the impact of COVID-19 on the quality of life and mental health, and through a number of stages of the pandemic. We also want to identify any additional supports you needed that you would have liked to have had to improve the journey to return to what we'll call normal or your normal, and to become more resilient for any similar kinds of things that may come up in the future. And I don't think we're necessarily totally out of the pandemic yet. Certainly not everybody is. And who knows what the future holds. So the idea is that we want to engage everyone to get their input on the kinds of things that would be helpful for patients, families, and donors in that journey to make it better. And finally, one of the things we want to do with the information that you provide us as feedback here is use that as input to get funding for further research to improve supports and equitable access to those supports. What's available to people in North Bay may not be the same as what's available to people in Toronto or in Calgary or in Edmonton. So it's important that we identify opportunities and then provide some more research in that to really detail this out. So this is kind of a first step of that funding process. Next slide, please. So to do that, our introduction effectively is what we're doing now. Then we're going to go straight into asking you how you felt during the various stages of the pandemic. And there's two parts to that question. The first one is just sort of how you felt, better or worse, through each of those stages. And then the second question, we're going to ask for your input, where you actually describe especially some noticeably either painful or it could be pleasant, could be whatever you experienced that was different during those stages of the pandemic as compared to before the pandemic started. So then Sherrie's going to take over. And for items 3 and 4, for item 3, she's going to take you through looking at the supports that you might have had that were useful. And then she's going to ask you to provide information on additional supports that would have helped you return to your normal and become more resilient in the long term. And then finally, the little pitch at the end where we're going to try and share with you how you might be able to become an advocate for change in this process as well. Next slide, please. So this section again is we would like you to describe how you felt during the various stages of the pandemic. Next slide, please. And when we're talking about stages, we're considering 4 stages of the pandemic. So the first one is the before stage, and you see underneath there, it's a young girl walking around blowing bubbles. Everything may have been hunky-dory, and then suddenly stage 2 hits, and we're calling stage 2 the first 3 months of the pandemic. Again, this was shared differently all over the globe in terms of when this exactly happened, but the picture there is a young man who's got question marks that I always thought of. He's probably standing in front of the shelves that used to be full of toilet paper, and suddenly everybody's taking all the toilet paper. And it was a very kind of confusing time for a lot of people. People were scrambling, trying to react. And that was sort of an initial 3 months of the pandemic. Next stage 3, was effectively during the waves, and so you see the person on the surfboard flying off those waves, and that's sort of how it felt, certainly to some of us, and maybe to a lot of us, that all the newspapers started having graphics online. You had graphs that were going up, going down. It was getting worse in this country, worse in that country. So it was really the chunk after the first 3 months to really almost till today, where we were riding those waves. So we're going to ask you how you felt during that time. And then finally, stage 4, which is effectively now. And I'd like to say we're post-pandemic, but that's probably not quite true yet for a number of us. So that's what we'd like you to do. So on the next slide, please. Describing how you felt. So we're going to get into the 2 questions. The first one is just a general how you felt. The second one will ask more specifically. And when you're talking about feelings, there are lots of different feelings that you may have had. Some people may have thought it was great their jobs went online and they were able to spend more time at home with the kids. Some people may have had more time to work out. You could have been a woman flipping giant tractor tires. But then again, a lot of other people may have been very frustrated because they had procedures to hospitals that got postponed, and maybe they were in pain. A lot of things weren't being taken care of. And in fact, if you were a caregiver, if you were a provider of services in a hospital, you may have been very anxious to go to work. There was a lot going on in hospitals. I sure as heck didn't want to go to any hospital, but a lot of people had to go to work if you were working in hospitals and healthcare settings. So they may have been more anxious. There were people that felt isolated and they were more depressed because of that. There were people, and it was overwhelming, certainly to me, that, I got tired of reading all the horrible news, and it was bombarding us. And other people may have felt very vulnerable. You didn't know if you're going to get hit. So these are all kinds of feelings that we're going to ask for you to contribute, whatever it was that you felt. Next slide, please. When we're asking initially, so the first part of the question is related to how you felt at each stage, and basically compared to what your baseline was, your normal. Did you feel a lot better or a lot worse? And it's on a scale of 1 to 10. So 1 being a lot worse and 5 being a lot better. Thinking back to each of those stages. Next slide, please. So that's effectively the description, what I just said. So you'll be asked to answer 1, 2, 3, 4, and 5 to each of the stages in terms of how you felt. Next slide, please. So in this phase, this is the phase where you're in front of that the shelves, no toilet paper, no hand washing liquids, disinfection liquid, people hoarding it in their garages. So the first 3 months, if there's going to be a pop-up here coming up on your screen, if you can answer during those first 3 months, thinking back how you felt. Did you feel a lot worse, a little worse, the same, a little better, a lot better? Okay, everybody have a chance to answer? And the results are, so again, and most people are a lot worse or a little worse. And I think that's probably consistent. And there's a little better and the same. So, but predominantly people's experience was that it got worse. And okay, so now we're going to go to stage 3. So everything's, the initial confusion has gotten a little more clear. And what we didn't know at this point is, again, which variant was coming at us, and what was happening all around. Same question again. Did you feel a lot better, a little better, the same, a little worse, or a lot worse? Okay. So let's see, it's similar, but nobody felt better. It was kind of the same, 9%, and we've got a little worse, 41%, and 50% a lot worse. So quite a bit worse. And then the last question. So it's effectively now, okay. So it's gotten okay. So it's the curve is flattened out quite a bit. So somebody earlier in the sessions was talking about the valleys of death, and but we're coming out of the deepest valley. So a lot worse, still 14%, which is significant. A little worse, still 33%, but more leveling out in terms of the same and a little bit better. So, okay, thank you very much for that input. That'll be very useful as we move forward. Now, the second part of this question, can I have the next slide, please? We're actually you're going to get, I think, a link in the chat, if I am correct. And so what we're asking here is if you could be more descriptive of things that stood out during any of the stages. So any kind of health challenges that you had, mental health challenges specifically, if that's what comes out. If you can go to your whiteboard, and so is that link in the chat?
Yeah, I'll post it right away.
Thank you very much. I didn't know if I had to put that in the presentation or not.
No worries. Here's the link, and I'll
Okay, so on that Jamboard, you're going to be able to type some things onto stickies and effectively going back, there we go. And so if you can add, so adding a sticky note is to your left-hand side. And I see the cursors going around there. So you can just click on the sticky note and you could just type in my health challenge or whatever it was, during stage 2, and there's a couple of examples on there if you'd like to read those. So please take your time and add some stickies on the specific events or situations that you remember that were particularly challenging during the COVID pandemic. All right, is that, you went to the next slide. Is that to keep me on time?
Yeah, so the Jamboard will remain open,
Okay.
but I think we can, yeah.
Yeah,
Thank
so again, this is going to be open for the rest of the time, I think, right? So keep putting things on there if you want to share that. Again, it's going to be very useful information when we submit for funding for the research, because I think these are the real experiences that people have had, and I think we need to be clear on that. So which brings us, so I guess I won't summarize that then. So what I'll do is introduce Sherrie, and Sherrie's going to take us through the next part of the session here.
Thank you, Rienk, and all of you for your voice adding to the board. I think it's so important that we can collect as much feedback and perspective from patient partners. This is a very trying time, and to be able to bring that content and that voice into a grant application of why this is important, I think is incredible. Often in research, we have scientists that are speaking and interpreting our voice. So it is really nice when we can get concrete, direct quotes, anonymous quotes from patient partners, caregivers, to be able to support the work that's being done, and that knowing that the voice truly belongs to us. So thank you again for all of that. Keep adding to that board if you can. I know we could probably fill up about 5 or 6 of those boards, but I really do thank you for that. So this next chapter we're going to look at is identifying ways, resources, tools that would have helped reduce pandemic impacts on your mental health. So really trying to problem solve. As Rienk said, it would be nice if this pandemic would be an endemic at this point, but it doesn't look like that's what's happening at the moment. And even though we are hopeful for a nice summer where we can all take a little breather and be outside a lot more and feel a little bit safer in our environments, we also have the fall to look forward to, and whatever that might bring, in addition to cold and flu season, and however this pandemic continues to translate. So the idea is to take more of a proactive approach in seeing, what can we learn from each other on where we've been, and then talk about like what maybe would help us with those next steps and how we can, again, use things from each other that may have worked really well that maybe I didn't use that I can pull from you and borrow. But also, again, add this next level of patient voice to our research application potentially would be very useful. So I'm really counting all of you to participate just as you did last with Rienk, and help me out with really, let's work together and see how we can help each other out. Next slide, please. So we know there are many different things that either can improve our health or can actually impact our health in a negative direction. So we have many different systems, and this nice little infographic you see on the left is you in the middle. And you can see all these wonderful circles. They actually, they're not just a circle that's contained all on their own. So education just doesn't stand there by itself. It interplays with all the different circles around it. So we'll talk a little bit, I'm just going to be really brief about what some of them mean to give you a sense of where we're going with this. And then I'm going to have you do a little bit more work to help better inform how we can help each other out in becoming more resilient during these times. So we take a look at ourselves. There are certain things that we have some power over in our own way, like our own ability to either move in this world or not, and that's our personal power. Some of that personal power depends on how much privilege you have in the system. So if we, one example would be for education. So if you have, high school or university or college, post-secondary, it may allow you, different levels of education may allow you to actually understand some of the messaging and, research that's out there, where you pull your information from, how you interpret it, if you feel confused. And let me be clear, even with all the academics I have behind me, a lot of the information can be very confusing to begin with. So you're not alone no matter where you are at. But I want to say with education, the more education typically, it allows you to be able to not only understand the information, but then also to be able to access and find ways within the system to use that information. So it's called functional information, functional health literacy. So that's something that can be very helpful, or it can actually be a limitation or a barrier if you don't have that opportunity. And if the language that's being used in public health is not being used to be able to satisfy the understanding of the general population. So that's something, that's just an example of how what supports, may impact you. We also have things that are in the system that really, can empower you or can cause limitations in your world. So when we take a look at a system you don't have much control over is, whether, the city around you or the rural space around you, what does that green environment look like? Do you have any? Were you able to get out and be physically active during this time? And that may depend on whether you're in the city and you're counting on using, the different equipment pieces at a gym, or, if your child is a transplant recipient, whether they were enrolled in different youth activities and group organizations, or maybe you do have a lot more green space and you were able to walk and feel that you had a good amount of distance around you. So as you can see, some of these systems that are around are built, are natural or physical environments that we don't necessarily have a lot of control over. But again, these are things that can impact, how we handle, the stress within the situation of the COVID pandemic. Again, looking at health and access to healthcare, we can take a look at things again, like where you live, whether you live in a rural environment, whether you live in a country, or whether you're in the city, and if you have access to your healthcare providers and how that looks during this pandemic, or with the shift of virtual care, did that make things easier or worse? Or, and as I said, things sometimes the circles can come together and overlap. If we're using virtual care, Did you have access to internet services? Did you have a portable device, a device that actually worked and you were able to log on and be able to connect with your medical teams? So these again are the things that we're looking at. The last two bubbles I'm just going to talk briefly about, and then we'll move on to more of the exciting part of this, as your social and community. So again, we're looking at the supports you might have. So those are the ones that are probably easier to identify. Things like people that are close to you in your life, you know, your family, your friends, any support groups that you have. These are, you know, your way of connecting and belonging to this world, whether you feel supported or not. And sometimes it can be a real barrier. Connecting and feeling like you are understood and seen and supported can impact you positively or negatively. And with, you know, everyone doing potentially their own understanding again of what's going on in the phase that we're in, people are handling the pandemic differently, whether they have an underlying health condition or not, can really impact, you know, how people are functioning. And then I know I saw in the posts on the board, with one of the ones I saw that I thought was really cool is just, you know, seeing other people do stuff and maybe not having the same opportunity to do that. So that's again part of your social, and that can impact your mental health if you don't feel like you are belonging and being able to function the way other people do around you, especially when you're seeing it on social media and places where you often visit. And again, the last one we talk a little bit about is economic stability. This is just talking about the, you know, again, can come to personal privilege and whether you have the opportunity to work from home or whether you have to go into office or you're a frontline worker, whether you're, you know, able to afford different things to increase your safety, whether it's an N95 mask or, you know, different, whether you're able to, you know, have private transportation versus public transportation. All these things can impact your risk and ultimately can increase risk of mental health as well, not only physical risk, but they're connected in your well-being. So some of these examples, I'm just going to give you, actually we'll flip forward to the next one. I've kind of talked about the little slides of who, what, where, but we'll come back to that one again. I just want to go over this so it's clear in your mind of what we're going to do. And then I will actually go forward one. We'll go through this part of it, and then we'll flip back to that last slide once I'm done going through this slide so that we understand what's going on. So in this exercise, we are going to identify some of the supports, the who, what, and where. And we'll go, like I said, we'll go through those. So don't worry too much. I'll go back to those. And what we're going to do at some point, a pop-up window will come out. You'll break out, and it will break out into two different groups. One will be for patients, and the other will be for caregivers. Now, there will be a potential other group where you don't identify with either one of those. So if that's the case, you just get to choose whichever one you want to go to. So don't feel bad. And I'll alert you to that once we come to that. Then you will join the breakout group. And the two questions that we're going to pose to you, the first one being, please identify what supports, the who, what, where, were available to you that helped you navigate the pandemic. So again, things that really helped you, like get through this, feel supported, impact your mental health in a very positive way, feel empowered, more confident in this journey. The second question we'll be asking is, please identify what additional supports, who, what, where, would have helped you to better navigate the pandemic. So things that, you know, we hadn't really, during the pandemic, you may have thought, well, if this would have happened, this would be so much better. I would have gotten through this so much better if I only had this. So we'll go back to the last slide. So Rienk and I will help you guys navigate those two questions in the breakout room. So Stephanie, are you there? Perfect. So I'm just going to give you an example. So this is a bit more clear. So when we talk about what resources would have helped you navigate the pandemic, I'm going to give you one example that can help you place the who, what, where idea. And Rienk and I will both try to just share this slide so that it's accessible during the breakout rooms. So for me, the WHO, so I was very fortunate during this pandemic to have a connection with CDTRP, and I had a family, I want to call it, of transplant recipients and caregivers that I was able to engage with. What we did, so what we did is we met in a peer support group. We were actually part of a study, coincidentally. This is how wonderful this group started, but it started as a study to see how people coped. So the peer support group, it turned into a peer support group, which was originally just a check-in and see how patients were doing during the pandemic. We turned into a peer support group, and we met every week throughout the entire pandemic, and we still continue to meet online in a virtual space that was very safe. And I can tell you that this group helped me feel like I had a voice during the pandemic, and it mattered, that that other people felt similar to me. So our language that we were using and the voices that we were sharing was definitely lived amongst us. It was a living, breathing feeling that we all shared. So I felt like I belonged to a group, and they have become my extended family, people that I love and trust, that we all have shared ups and downs, and we've celebrated and we've cried together, and we just like really have given the support to each other to pick up and, get through another 6 days, and then, really look forward to reconnecting. So that was like an example. Hopefully that was clear to you, but you can use other examples. So your WHO could be family, friends, caregivers, employers, recipients, support groups, institutions, governments, and nature. So any of those things, or even other things that we're not listing, you can use. What would be areas of nutrition, exercise, income, education, information, treatment, health policies, awareness, or research? And again, it could be things that we're not listing. Where could be places of home, school, work, stores, transplant centers, hospitals, pubs, and sporting facilities, again, and things that aren't listed. So just to give you an idea now of something that I wish we would have had, a resource we would have had, and again, speaking to my personal story, I can put this together for you. For me, a resource that would have been wonderful is health policies that spoke to vulnerable populations. So for me, it's about the inequities, especially around dropping of the mask mandate during the rise of a COVID wave, that it would have been nice to have, for me, a resource or a support where we would have had leaders that stepped up for vulnerable populations that maybe, that ended up impacting my mental health in a negative way. And so it would have been nice to have a group of peers, advocacy group, to be able to rally behind health policy changes that maybe negatively impacted our group, to be able to support us and to be able to make sure we didn't feel forgotten. So that's kind of what we're looking at from you, to get some insight that will help push research and generate ideas, and really get your voices heard within research and our applications, so that we can do more work together. Okay. All right. So Rienk, would you like to go first?
Sure, the patient group can go first.
Perfect.
Now, I don't see now, so I'll just have to try and summarize it. Why don't everybody can pitch in, in terms of what you heard and what was important. So I think that here we go. So this is so for question one, we talked a little bit about sort of what was available in terms of information where people went to when it all started. And so there was some discussion on that dashboard. There was the young lad who sort of invented his statistical analysis machine or software that he then lent to Johns Hopkins, I think. And and we were getting information from all over the place. So that was useful. The problem with it was trying to see what was, real information versus not real information, what was verified, not verified. So it's looking at multiple sources. And the problem we had initially is a lot of it was a bit random. And so there were some specific public health units that did a good job, and CDTRP had that support group that seemed to have done wonders for people, because it became something, turned from what was a project into really a group that there were people could share a lot of information and openly. And this was another thing we talked about a little bit, that not all the information was depoliticized, and so it wasn't always possible to get uncurated information. So I think that those were some of the things. So people were getting information, but it wasn't always easy to find and consistent, and that was a real challenge. And that everybody's sort of in the same boat. So that was, I think there were some places, but it was still lacking. And so on the second question, then, in terms of what people would have liked to have seen, it was really more related to getting that information in a format that was understandable, first of all, and also more coordinated. So we know we had different policies across the various provinces, and different policies in different countries, and different situations in each of the countries. So, but it was a bit of a free for all. And so we would like in the future, for sure, the group would like to see in the future a little bit more consistency, and a little bit more consistency in terms of the information. There were some suggestions that, hey, we should have had a better consolidated view with with other people that were immunocompromised or had other reasons for being sensitive to potentially being affected. So like with the cancer, the Cancer Society, I can't remember the name necessarily that people were talking about, but any of the cancer organizations, that we should have coordinated that better. So maybe in the future we can do that, where we collaborate more with other groups. And so the probably continue some of the abilities to share openly as opposed to politically, but coordinate much better. And so the other thing I came across is we need to do much better at the education and awareness, even down to the family level. So, it was, and I think it was Donna was mentioning that, it's when you go visit your family, and some really don't care, and some do care, and, oh, who needs to wear a mask? These things, but most of that is probably based on lack of understanding. And so the awareness needs to be everywhere. When we talk about the who's, every one of the who in that list, probably we need some better education on understanding in terms of the impact of being immunocompromised, or the impact of something like a COVID pandemic on immunocompromised people. So why are you wearing a mask? What is wrong with you? We have to get rid of that stigma and just be more clear. Talked about the fact there's some masks available in Quebec, where they have a little insignia on there, but it sounds, from what Sandra was saying, it's quite small, so it's kind of hard to see. Plus, I'm not sure if everybody always wants to walk around with, oh, hi, so you want everyone to know you're immunocompromised, but you don't. You still want to be a person. It's sort of it's a funny sort of a concept, but somewhere where it helps people understand the impact. And so in the future, that we should be able to recognize more easily, what who's immunocompromised, what that means in terms of support, whether that's support in schools and other students understanding, teachers understanding, or whether it's even in going to medical facilities where you cannot be separated in a medical facility when you're sitting in the waiting room. You might be sitting next to a whole bunch of people that are very ill, and you really don't want to catch what they have anyway, whether that's COVID or not. So there are some things that were identified that I think we can use in our submission for research grants, or certainly things that can be researched better, to make sure that we do have the resilience in the system, as well as in the people that are part of that system. The individuals, from families to to communities, to, to schools, to other institutions, so that there is just better awareness, better coordination, and more of a recognition of how we can actually accommodate that. So I don't know if that's fair. Anybody else from our group? I don't know if I got all of the ideas in there.
I just thought of another one to add. And this is from the States. I don't know if it's possible in our system, but when they are told to go to the hospital by their doctor, there's usually a clean room for them to wait in. I mean, they know they're coming. It's like hermetically sealed, and in you go.
Yeah, these are all, possible things to look at, I would think. Anybody else? Murray?
All right, so just in keeping with time, I just want to make sure we get through this last little bit before Sandra, I'll come back to you in a second as soon as I get through this. So our group, lots of great feedback as far as supports that were available to help navigate the pandemic. Virtual seemed to be a really big plus with education, job, and clinical appointments. And a lot of the people the caregivers within the group indicated that, that a lot of resiliency in being the resource, being resourceful in securing your own social system, securing information. Caregivers typically hold the hat of caring for others and being educated. And that really, I think that was communicated really loud, that being a transplant recipient caregiver, we really want the information to make the right choices and to be able to gather the supports that we need, the networks, and advocate the way that we need to. So I think that, the actual caregiver seemed to be the resource and the support and the tool that helped to get through the pandemic. And that history of, I guess, having that role and having it since transplantation and being used to that path of being able to find those resources and being more resilient and having to have been more resilient in those places. So I thought that was really interesting. On the what additional supports would have helped better navigate the pandemic. Virtual also came up on that because virtual isn't always being offered. I guess the definition of virtual, what is that? Some of, if it's a phone call, is that virtual? So I think that the quality of virtual care, we're talking about that, is that if we can hold it to a standard where, virtual care, if it doesn't require, and if it's applicable where hands-on aren't needed, if we can have access to virtual care that, is able to get all the clinical information and connect and all of the things that are important for in-person visit that you would be able to do virtually to have done, that would be wonderful. So maybe a more standardized kind of option with virtual care. Communication was a big one. Communication from media and messaging, communication from our transplant centers, and for the transplant centers to have some consistency across, and transplant organizations to all have consistent messaging. I think that was something that would have been, great. I know that as we're learning as it goes, it's not always easy to throw that information up, but that would be nice. The idea of having information accessible as it becomes available would be also a great resource. And I think that was it. Did I miss anything, Katie? I know you're my note taker.
I think you did a good job. You summarized things very well. Yes.
All right.
Yeah. I saw you taking notes
in the group. Anybody in the group that I missed anything either? I know it's really great feedback, so I can't wait to see the notes. And if you have any additional notes, any additional findings, I think that'd be useful for us. And I really can't wait to capture all the feedback that you gave, and so that we can present it to our mental health group, exercise, our mental health hub, so that we can then incorporate your anonymous feedback to generate a grant potentially in this area. I think it's really important. So our next steps, your perspective on the impact of COVID-19 pandemic of the mental health. We'll go back, like I said, for research potential grant, the additional supports you need to improve the journey to return to normal and become more resilient. So hopefully we learned a bit from each other to be able to see what worked from each other, and maybe grow as a group and open our eyes about awareness of what still needs to happen. I think that's great. There's lots to move and lots to learn from here. And we'll use it to help develop and submit an application, as I mentioned. So not done yet, just one more little piece. If we can go to the next slide. So, I truly believe, like, this is a research hub, and this is wonderful. And I love all the research questions that come out of it. But I also have a very big plug for advocacy for health equity. So basically that, that we all have a system that is able to support our needs. And so this is a little bit of something that I'm working on, is to be able to bring about vulnerable populations for a more just system, so that we have more personal power and more power within the system to feel safe. So as I invite you to join a platform for vulnerable populations of Canada determined to reduce inequities of the COVID pandemic. And what that vulnerable populations is that while diseases can make anyone sick, some Canadians are more at risk of getting an infection and developing severe complications due to their health, social, and economic circumstances. The pandemic has clearly had a disproportionate impact on the individuals and communities with the worst social determinants of health. COVID has exacerbated inequities within our society. This subjects those with inequities to be more infectious and more hospitalizations, more isolation from work and school, more lost income due to isolation, and more risk of long-term disability with post-acute COVID long-term syndrome. So my reach to you is that if you're interested at all in getting involved and in helping to push health policies and advocate for vulnerable populations, that we'll send, I know there's a link that will be posted. You're welcome to get involved. I would love to grow this group and be able to really use our power, our voice, to come together, to feel like we're not forgotten, to feel like we're not the collateral damage as in this life experiment with COVID, and really to be able to push our voice so we are heard and join other organizations of vulnerable populations, so that our needs are met within not only personal power, but also within the system, so that when we go into a next wave, if there's a next wave, that maybe we look at temporary re-mandating masks in public spaces where we have to go, so that it protects us. So that's something that I'm working on. The other piece in the link I know has been posted also includes, if you're interested in supporting mental health research with a letter saying this is important from a patient partnership, we would provide a template for you, and of course some information on what you're supporting, the research itself, so that you can see whether this is something you're interested in. So if you're interested in providing a letter of support once you take a look at the research, you're welcome to include that as well. So I believe that link is in, it is there. Perfect. Rienk, do you have anything else to add before we close the session, or?
The only thing is I did want to thank Stephanie for working in the background and making sure all those fancy pop-ups and all the fancy stickies and all that were available to everyone. And our note takers, Katie and Manuel, working frantically in the background. So I didn't have to do it. It was great. So really, we both really appreciate the help and support that you gave us for this. That's it.
Thank you very much, Sherrie and Rienk, and to everyone who participated. I definitely did learn a lot.